Morning, everyone. I think that we will get started. We probably will have a number of people joining in the next few minutes, but I think it's good to welcome you all and to have a few introductions. This is a very exciting session of the Global Health Committee, the overseas members. We have a big agenda on focused discussion on antimicrobial resistance, looking at specific engagement with overseas members and topic for future meetings, and CPD learning hubs. I would like to introduce firstly Vilida Travis, who is the lead for overseas members. Vilida, can you turn on your camera?
Yeah, I've just turned on my camera. Can you see me?
I can't see you. I think there's something wrong with my view, maybe.
Anyway, I'm here. I'm here, and I will talk later.
Okay, great. And then we have Alison McCullum, who is the professor in Edinburgh and chair of the European Special Interest Groups. Alison, are you there?
I am, yes. Sorry, I was on mute trying to manage multiple windows getting ready to chair the first session. So thank you so much.
Okay, thank you, Alison. And you will introduce the speakers on your session, so I'll won't introduce them at the moment. And then we also have Muna Abdel Aziz. Muna is the faculty's advisor for International CPD advisor. Muna, would you like to just say hello?
Hello, everyone. Yes, I'm really excited to be running this inaugural Learning Hub for the CPD Buddy Scheme. I'm a member of the Global Health Committee and the CPD Committee for the faculty as the International CPD Advisor. Thank you.
Excellent. Thanks very much. What I'm going to ask everyone to do is if you could just put your name, your country, and anything else you would like to add about yourself into the chat, just so that we know everybody who is here, and we don't spend too much time going through the whole list of people being doing introductions. We will be having an interactive open discussion session. When we have that, please, if you could turn your cameras on so that we can see who we have and who is speaking. Otherwise, any questions that you have, you can put in the chat and we will take them at the discussion time. So without further ado, those that don't know me, I forgot to introduce myself. I'm Elizabeth Mason, and I'm the chair of the Global Health Committee for the Faculty of Public Health. We also have Caroline Wren, who has been organizing all of our sessions, and Caroline is ensuring that the sign-in, the recordings, and everything goes according to plan. So thank you in advance, Caroline. And without further ado, I'll hand over to Alison McCullum, who is chairing the first session on antimicrobial resistance. Alison, over to you.
Thank you very much. I'm not an expert in antimicrobials, which is why I was so excited to chair this and to hear from our speakers. Really, what they're going to cover for us is, if we didn't need convincing, why antimicrobial resistance is a public health threat. And just to remind you of the broader context, our global failure to reduce need for antimicrobials through work that all of us contribute to in terms of our work on climate change and reducing inequities, and all the other things we do that reduce the risk of novel and known transmissions of infection that require antimicrobials. Our failure to build universal healthcare for all and a trusted network globally of primary care and pharmacy professionals that can work with individuals and populations to ensure that individual and community requests for antimicrobials are prudent and in line with stewardship guidance. That there are gaps still in our standards for medicines, their content, dose, duration, and distribution and procurement, that this work can help us think about. And also the work we still need to do to increase vaccination to reduce the risk of vaccine preventable and modifiable diseases, and rapid response to stem outbreaks, either of conditions that need antimicrobials themselves for control or that increase the risk of infections that require antimicrobials. And we're going to focus today on antimicrobial stewardship, and I think you'll agree the presentations we're going to hear embody all that is good and all that we need to more broadly as a public health community contribute to. We'll hear about regulations, resources, R&D, resolve to collaborate, the time that takes, and the resistance and resilience to keep going when things get tough. So I'm first going to introduce Dr. Amofa George Kwadwo from Ghana, who has a list of distinguished titles, but is a graduate of Ghana, University of Ghana Medical School, has an MPH from Leeds, and is a fellow of the Ghana College of Physicians, West Africa, and is one of our fellows through distinction. He's been the Deputy Director of Ghana Health Service till his retirement, but since then has remained as a real champion of this, and immediate past president of the Ghana Public Health Association, and continues with academic and leadership responsibilities in Africa and also through the World Federation of Public Health Associations. He's currently working with an international NGO as a technical advisor for non-communicable diseases. And I'm going to try now to share Dr. Afawa's slides with you, and hopefully my connection's going to allow me to do that, and that's to try and reduce Dr. Omafa, it's going to try and reduce the bandwidth that you require yourself. So let me just get this. Let me just get this up on the screen and get it into slideshow mode.
Okay.
Just because where my Zoom screen is, I need to try and it takes me a minute to get from, yeah. So here we are. Thank you so much. The floor is yours.
Thank you so much. And it's a great pleasure to be available to present on improving antibiotic use and the role of an AMR partnership on behalf of the Faculty of Public Health and the UK and Ghana Public Health Association. Just to give you just a little introduction on the Ghana Public Health Association, it's an association, voluntary association for the advancement of public health. It's strictly non-governmental, multidisciplinary, and it's made up of public health professionals of different categories, incorporated in 2014 in Ghana. And we are an affiliate of the African Federation of Public Health Associations and also the World Federation. Next slide, please. Yes, and as we said, the goal is to contribute to the advancement of public health for the promotion of health, prevention of disease, basically across the spectrum of health. And our mission, especially in relation to this presentation, is to collaborate with individuals, organization groups, and agencies with common interests in public health and related issues, both locally and internationally. And that basically is why we got ourselves involved with the Faculty of Public Health. Next slide, please. We have a number of contacts, and so next slide, you can reach us. The other partners are listed, UK Faculty of Public Health, and quite a number of other partners in UK, including Liverpool School of Tropical Medicine and other partners listed. Next slide. The context, as I've been explained, is that there is a silent epidemic of AMR, antimicrobial resistance, all over the world, Ghana included, and that led in 2018 to the development of an AMR strategy by Ghana. And it was at that time that we, as an organization, got ourselves involved. And so the following year, we got ourselves through Lekma Hospital, one of the district hospitals in Accra, and we partnered with UK Faculty of Public Health to begin developing a number of proposals, for the support of CW PALM's projects. And a number of the projects are listed. The first one was with Lekma Hospital, which ended in March of 2020. Then there was a 3-month extension for the same hospital, basically to establish a system of AMR in the hospital. We got a 7-month extension. We extended it to Lekma Polyclinic, and then the next proposal extended it basically to 5 other for facilities, but basically all in a Greater Accra region. And currently, we are continuing with the 2.5 proposal, which I will focus on shortly. Basically, the project is to increase access to AMS, antimicrobial stewardship, to reduce antimicrobial resistance in Ghana through North-South partnership with UK and Ghana. And the emphasis is on the AMS stewardship, not only AMR resistance, because without the stewardship, that is not possible. And some of the key objectives were about 4, increase the proportion of authorized health personnel demonstrating appropriate knowledge of antimicrobial resistance and antimicrobial prescribing practices in the 5 facilities. Can you go back just a little before this one? The objectives are, yes, then establishment of annual antibiograms in 4 facilities, then the establish a center of excellence, in some of the facilities, and then improve knowledge and practices in primary and secondary schools on AMR. Next slide, please. Based on this, a few of the key activities: build capacity of various health workers, establish antimicrobial laboratory surveillance, undertake joint multi-sector ward rounds, very important, and you are prepared to elaborate on that. Then undertake outpatient and inpatient PPS, point prevalence service, and then orientation of community pharmacists on their roles, and then community education on AMR, focusing on schools, churches, mosques, markets, and then the last to strengthen governance systems to establish an AMR system in the facilities. Next slide, please. Just a few of the results. Sorry. Yes, the next one. No, go back. It looks as if you jumped one key in the. Or is this the next?
The one I can see is the results.
No,
Okay.
one before the results, a quick one. Oh, okay. Then go to the results. Sorry. Go to the results. Just to give you a few of the as at 2024 increased percentage adherence to AMR guidelines at the OPD from 70.9 baseline to 90.9%. Increased percentage adherence to at the ward from 74 to almost 87. Reduction in percentage of misdiagnosis on treatment, and we reduced it from 47% to 23.2%, and the number of staff have been trained. We targeted about 200, we've exceeded it to over 340. Next slide. We are using a hub and spokes system, and the hub is the Lekma Hospital, which we started with, and then basically the 4 others are the spokes, and the hub has supported in different aspects: information sharing and learning opportunities, development of treatment guidelines, development of almost about 23 different laboratory SOPs by the hub, which are being used by them and others, training of the staff, as I've said. Then they've trained trainers from the spokes to do PPS on their own, and then the 2 Alpha A fellows have already been trained in partnership with and 2 others are actually undertaking it now, and they've been able to maintain the score for some time and now, and I think that is a key achievement. A few lessons we can share: mutual trust between different stakeholders, the North and the South, and the horizontal ones, quality of the hub facilitation, because you build the capacity of the hub, that they are now able to do that independent of even the others, to train others. Then leadership at the facility is always key. I mean, wherever we've seen that, it changes stance. And then the facilitation by the Ghana Public Health Association as the coordinating hub of the partnership. And next slide, I think we are almost done. The next one. Yeah, a few conclusions so far. Because of time, we won't go into other details. There's definitely improved knowledge and practice among prescribers on AMR project, and I think the results showed clearly about that. Then Lekma Hospital is now a center of excellence, and the capacity actually goes beyond Ghana and to other places, and they've built the capacity of some of the hubs to do that. Then bi-directional learning is possible between the North and South health institutions. We've gotten support from the Faculty of Public Health to develop various systems in terms of sharing of experiences and expertise. And the last one is that it's possible to establish AMS system in health facilities in lower middle income countries such as Ghana. Just 1 or 2 photo galleries just to show you some of the evidence. Yeah, these were during the World celebration of Antimicrobial Day, usually in November, by the facilities. And then the next one is radio sessions ongoing. Then the education at the mosques on the left, at the school in the middle, and then in churches, pulpits, are all part of the activities that are ongoing. I think that is basically what I want to share for now, and thank you for the opportunity.
Thank you so much. That was incredibly inspiring. And yeah, what a fantastic session. Can I, we have some time for questions after this, so I'm quite keen, can we, if we can move on to our next speaker, please. Thank you so much.
So Alison, maybe you could just introduce Muhammad Ali.
I'm just trying to find Mohammed's bio, which has I'm afraid disappeared off my screen. So that's the reason that I don't want to delay it for that purpose. Because my system has just logged me out of my email.
Maybe Mohammed could introduce.
Perhaps you could introduce yourself, and I can post it up afterwards, if that's okay.
Mohammed, you're on mute.
Sorry, I'm just trying to sort my sharing out, and then I will introduce myself. Just give me 1 second, because I'm more of a Teams person, so I'll see if I can just get this sorted.
Yeah, because I thought I was sharing your slides, Mohammed.
That's okay. Let's see if
That's why I'd moved away from your bio. I'm so sorry.
It's all right. It's not a problem. I'll see if this. And then can everyone see my screen now, or is it?
Yes, we can see that.
You can see the slides, yeah?
Yep.
Oh, perfect, yep. Brilliant. Right. So I'm Mohammed. I'm an epidemiologist at the Leicester Real World Evidence Unit, and I'm also the co-chair for the Pakistan Special Interest Group, where I work with Dr. Samuel Latif. So I'm also part of the Global Health Committee as well, and I've got various interests in non-communicable diseases, particularly heart failure, multiple long-term conditions, and diabetes as well. So I won't dwell on it and introduce myself much more than I've said already. So I'm sure Alison can share the details in the chat. So thanks for that. So this project that we developed with the Special Interest Group for Pakistan was really about raising awareness for antimicrobial resistance. So Samir is the co-chair alongside myself, and then the vice chair for this Special Interest Group is Professor Zafar Iqbal, who's also the vice president for the faculty, so something we're very proud of as well. I'll just talk about I'll just discuss the outline of the talk. So I'll mention about antimicrobial resistance for the global health issue, but really coming from a Pakistani lens. And then I'll talk about how we piloted the commercial determinants policy for the faculty when we developed a relationship between the company that delivered the educational session and the faculty, and then how we developed a letter of understanding and why that was important. And I will go on to the results for the project as well. It's quite a big issue globally in terms of the number of deaths are increasing year on year. There's over 1 million lives lost per year since, in total from 1990. The data for Pakistan in particular is quite stark. We see there's about 40,000 deaths that are attributable to antimicrobial resistance, and 161,000 deaths are associated. So the difference there is, in terms of attributable deaths, that's those that if the drug resistant bacteria wasn't drug resistant, we wouldn't have those deaths, and the ones that are associated, if the infections hadn't occurred in the first place, we wouldn't have that level of mortality as well. But this is just looking at some data for Pakistan in particular, so the number of deaths. So from 1990 to 2020, you can see a general increase in the number of deaths, increasing decade to decade, and then you see a slight dip in 2020. So that's all the data that we've got to date. But what's a little bit worrying is the projected increase from 2030 to 2050, particularly for the more elderly population, so people over 70. You can see that it takes a great proportion of the number of deaths into 2050. So it's quite important that we do some work around raising awareness for antimicrobial resistance. And it's just to say that Pakistan is really quite high in terms of the rate of antimicrobial related deaths as well. So really, really important that we do take as many steps as we can to reduce this burden. So a few of us got together to develop a project. It's quite a collaborative effort. So we partnered with the Advocacy with Professor Diane, who's a pharmacist, but also is doing some really pioneering work around antibiotic guardianship, where you make a pledge, which I'll come on to. Nadia is a member of our special interest group who led the project from Pakistan. So she is an associate professor with training in pharmacy, but is also part of the senior leadership team for this healthcare provider. So in Pakistan, health is quite devolved to the different provinces, and there's a mix between public and private providers for healthcare delivery. Samia is a consultant in public health, who's also the co-chair, and then Fazl is one of our specialty registrars as well, with a background in pharmacy. So there's a commercial determinants policy that the faculty is quite keen on pushing forward. It's really important that we consider the sort of commercial determinants, particularly when we're engaging with different actors that we want to work with, because obviously in lower middle income countries we often see that healthcare is delivered by private entities. So we just want to make sure that the values do align with what the mission is for the faculty. And as part of the project, Nadia was quite keen to sort of formalise a relationship, so it gives a bit more credibility as well to the project as a whole. So we developed a letter of understanding between the faculty, and essentially what it's doing is giving it a sort of a passport to partner with the faculty. So there's clear rules, reduces any sort of reputational risks to the faculty as well, and all about sort of delivering what the public health advocacy mission is for the faculty as well. But in terms of the project itself, quite simple in nature. So we had a pre and post awareness questionnaire. So we then delivered an educational session in between, and just to see if there was any differences in what people's knowledge and understanding was of antibiotics and antimicrobial resistance. So we recruited corporate staff, university students and staff as well. And so we had over 300 invitations sent out for this project, but ended up with 260 participants, where they had a pre and post questionnaire, as well as having the session as well. So just briefly, in terms of the people that were recruited for this project, so most were women, which is good to see from a low middle income country, and particularly in Pakistan. And the roles of those were recruited, so there's a mix. So this isn't every single group, because it doesn't add up to 100%, but we can see there's a different sorts of seniority and experience in those that were recruited. So just to highlight that, under half of the participants said that they knew something about antimicrobial resistance, and therefore, most actually had no prior knowledge of what antimicrobial resistance was. So this is just a couple of sample questions that I'm just sharing here. So there was many more within the actual questionnaires, but it was things like, what do you think causes antibiotic resistance? How serious do you think it is as a global health issue? And there's a few others that we asked our participants as well. We didn't want to reinvent the wheel as such, so we tried to use infographics and information that was already produced, and WHO do some fantastic resources, and there were some from the UK HSA as well. So this is just what we showed for the educational session about what causes antibiotic resistance, and then about what happens when you overuse and misuse antibiotics as well. So the results, I mentioned already that the awareness of antimicrobial resistance was under half, and after the session, nearly 100%, which is good to see. So most people did know that antibiotics were used for bacterial infections, and that increased post-session. And importantly, there is a bit of a misconception around using antibiotics for colds and flus. So over half did think that is what it could be used for, but post-session, we close to 3/4 said that it's not essentially for colds and flus, which is good to see that the session brought that across. So in terms of the next steps for the project as a whole, Fazl, who's a specialty registrar, as I mentioned already, has drafted the publication. So we're hoping to get that circulated to the other co-authors and have that sent off, and then develop further work around the antibiotic guardianship pledges. So as part of the project, we asked people to to pledge a single sort of statement of support of what they may do around raising awareness for antimicrobial resistance, and that's led by Prof. Diane as well from the Africa SIG. So I will share links at the end of this talk where people can go on and see more about sort of the commercial determinants aspects and learn more about our SIG and the guardianship aspects. So short and sharp. So thank you very much for listening. And these are just sort of the references at the end. Thanks.
Thank you so much. I've just put some links for people about you into the bio. I hope that's all right. Your LinkedIn profile and your ORCID. This will also be easier for people to look at in their own
That's fine. Thank you.
time. But fantastic, fantastic work. So thank you so much. And the Georgia Mofa has highlighted the importance of the developing MOUs and so on. And we now have a few minutes for an open discussion, both to ask the presenters questions, but also how we'd like to take this forward. And a reminder that this is a global CPD session. So any question is really important to address some of the misunderstandings that, for example, that Mohammed has identified. So colleagues, the floor is yours. Thank you so much. Victor.
Thank you, Alison. Thank you to Mohammed Ali as well as George Amofa for those two presentations. I think that's really helpful. I'm the chair of Africa Special Interest Group. The work around the antimicrobial stewardship was one of the first partnership we had with Ghana. It's a mature partnership, as Professor George Mofo said, and it's grown from strength to strength. And I suppose key thing for both of you is really, I think it's good we hear about this publication, which is good. We know that we cannot be able to do this for every country, but the key thing is do it well, however it goes, and share the experience with other people, other countries, so that they can be able to take the lesson. I think there are a lot of encouraging initial work I can hear from Mohammed and from George. I know this is not the first time they had presented to us as part of our Africa Special Interest Group webinar. And it's kind of well received, one of the good examples. So I think perhaps a question reflection is how are you going to ensure that the work is disseminated across your sub-region? And that's really important. We have other partnership on the antimicrobial partnership in Nigeria and in Kenya as well. So yeah, back to you, Alison.
Thanks very much. I'm going to ask Dr. Amofa to answer that, and I'll just put my own comments in the chat about Portuguese-speaking nations. Thanks. George, are you able to?
Yes. Fortunately, my General Secretary, James, is also on the call, and so he actually handles some of the communication issues. And I think we listed quite a few channels. But just to indicate that I also happen to be a board chair, executive of the African Federation of Public Health Associations. And one of the things I'm actually going to propose to the SIG is how the African Public Health Federation will be able to link up with the African SIG, because I mean we are basically doing almost the same thing. And so in terms of dissemination and communication, that is one wing which definitely we are sharing. We are also actually doing same in publications. I didn't mention some of the publications that have been done. I mean, the delayed prescription has been well authored and accepted and published. And so, yes, I mean, we agree that publication is quite important, and we are also doing same through other networks. James, do you have anything to add? Oh, you can go on. She can.
Mohammed, did you want to say anything about knowledge exchange, and then I'll bring in John?
Yeah, sure. I mean, being an academic, I know that we can just go into our own little bubble and just say that the paper's gone out and that's our dissemination strategy, a big tick. But we're obviously keen to make sure we go beyond that. Within our SIG, we've got quite a large diaspora of public health professionals and medical professionals that work across Pakistan and here. So the aim is really to sort of build on the work here and take the next steps forward so we can get it out to patients, develop the sort of the collaboration with the Africa SIG and Diane as well around the pledges, and see whether we can sort of raise the awareness as much as we can from patients and other healthcare professionals in Pakistan.
Super, thanks very much. John Gayapong, very welcome to have you here. Please, your question or comment.
Hi, good morning, everybody, and great talks. I have two questions. First, for George, my friend in Ghana. I just wanted to know why you specifically targeted senior high schools in your objectives. I mean, I'm not sure the very reason why senior high schools in particular were targeted. And then to Ali in Pakistan, the data that you showed, initially you made some projections of death, and I'm not sure what informed those kind of projections. If you can explain a little bit, that would be great. Thank you.
George, do you want to start?
Yes. Yes, Donny, thank you for the questions. In other words, it's actually the target is primary and secondary. But if you look at almost all of them are actually primary, but where the secondary school is nearby, then they will normally target that. But the focus has always been the lower level. There is a question about TB and yes, AMR resistance. Yes, in fact, you cannot dissociate the two. I mean, they are interlinked, and the principles are the same. And the focus in Ghana definitely includes all types of antimicrobials, irrespective of the target disease. And so, yes, the TB in particular is a major source of worry. And there's a whole program on its own, I mean, supported by the Global Fund, I mean, to address issues related to TB and AMR. Over.
Thanks very much. Before I bring in Elizabeth, I was just going to say thanks so much for your excellent question, Christian, about working in silos. This is, I guess, I've always seen this as part of the public health role across local areas, across neighbourhoods, across regions and across countries, is to bring people together to work across silos. And one of the tools we have as a faculty of public health that is worth replicating in other countries is the fact that our fellow colleges and our parent college, the Royal College of Physicians, actually has, for infectious disease physicians, for general physicians, and for GPs, we have those shared objectives around educational areas, which we could use these as case studies to try to address. I think that's definitely worth us thinking about as part of this hub idea, and thinking about that going forward. But we in public health, I guess I'd always see us as being the people who try to break down silos, and often our only power is convening power to bring people together. Thanks, Elizabeth, and then Kevin.
Thank you very much for two excellent presentations. Just a couple of quick observations and comments, and one or two suggestions. I was very impressed by the lack of knowledge, of basic knowledge on AMR, and I think that that's something in terms of public health that we need to really be looking at in that awareness raising across the spectrum of use of antimicrobials, whether it be for TB or whether it be for any other illness. But I do know that where antibiotics are paid for, there is often a issue of saving money and therefore sharing. Because it's you get then two people treated for the price of one, so to speak. Obviously that is not correct. And I wondered if there is a comment from either George or Mohammed on that issue of sharing rather than non-completion of courses, but how much sharing goes on. And then secondly, the network of public health associations certainly is a avenue for spreading the word and looking for ways of increasing awareness. And again, a comment as to how you think that network can actually help with raising awareness further. Thanks.
Thank you, George. Mohammed, do you want to come back? George first, then Mohammed, and then I'll bring in Kevin. And then that's probably our final question.
Well, I actually take it as comments, and so the only thing is to say that CPA and the Global Health Partnership has websites which we actually share quite a number of these information in, and also the Ministry of Health has an AMR secretariat in Ghana at the national level, and the information and others are also shared with them for wider dissemination. So yeah, I think specifically to that, yes, that's what I was saying.
Thanks very much. Mohammed, do you have anything to say before I move on to?
Yeah, just briefly. So I don't know a huge amount. I know I did come across a paper about people sharing antibiotics. It's normally where they've got some left over and they store it and then they give it to another family member who they think they've got a similar sort of infection. But I don't think the data is that great really in terms of how much sharing is actually occurring.
Yeah, certainly worth examining in all income countries, because anecdotally, I'm sure we all have examples we can think of. Kevin, over to you.
Thanks very much. I'm Kevin Kelleher. I'm a retired public health physician who worked in Ireland and previously in the UK, and I'm a member of both the UK faculty and the Irish faculty. I led the AMR process in Ireland for 10, 15 years, and we had increasing success, but the problem was maintaining it. And that really reflected around the individuals. And it always worked well to begin with, because there's lots of youth enthusiasm and resources. But the question is, how does it work when it just becomes a routine part of the system? And how does it work when it's not in the academic scenarios? So how does it work in the rural hospitals in both of the countries?
Yes. In other words, when we talk of the hub, let's say Lekma Hospital is an urban hospital. Then almost all the other spokes are what you would have classified as rural, in quotes, or peri-urban facilities. The AMS system, as I speak, is well integrated in all the five. As part of even their ongoing orientation. You see, staff turnover is quite high, but there's a regular system of integrating new staff who are brought into each of the facilities on AMS, and that is brought in by senior management. All the senior management of these facilities are part and parcel of the AMS committees. And so that really is the beauty of what is happening now. And a number of the things that we started as part of the project, which we don't have funding for, are actually now being funded by they themselves. I mean, as part of their routine services. I mean, including the delayed prescription and quite a few other interventions to do that. And so that is quite important. I mean, without their inclusion and buy-in, then sustainability will be a problem. But unfortunately, that was a part of the project to build a capacity in all of them so that they become centers of excellence. And one of the criteria is how do you sustain the interventions in the absence of funding. Over.
Thank you so much. I think that's our final point we have time for. We could have gone on for ages. I think we will all have great ideas around how we use our public health skills to stop things from becoming cyclical problems, as Kevin alluded to. And as George gave us some ideas, how we make those systemic change for the good. And perhaps if I can ask Phillida and Liz and Muna, if we can think about how we can capture people's ideas in order to forward this agenda with those that are leading it. Thank you so much. I happen to have both of our speakers' slides. If you're happy for those to be shared, then we can share them afterwards through our CPD lead colleagues. Can I now hand back to Liz, and thank you so much for such fantastic presentations, great comments, and I think you've sparked an interest in snowballing this important area of work. Thank you.
Thank you. Thank you so much.
Thank you very much indeed,
Thanks.
Alison, and thanks very much to both George and Mohammed for excellent presentation and to you all for a very, very fruitful discussion. Without further ado, I will hand over to Phillida Travis, who's actually going to lead the session on developing engagement with yourselves as overseas members and topics for future meetings. And certainly we need to look at how to take the various suggestions from this session forward. So Phillida, over to you.
Thank you very much. Can you hear me and can you see me? I can't see myself, but if you can hear me, that's good enough.
We can do both.
Good. Okay, hello everybody. I see we have 41 participants, which is great and hugely diverse from lots of different places all over the globe. I'm the new lead on overseas membership for the Global Health Committee of the faculty, and I've got a few minutes, maybe 10 minutes I'll try and stick to float ideas with you and get ideas from you about how to increase our engagement and topics for future seminars as well, because that's the sort of bread and butter of the role I've got, at least initially. The proposals I made on engagement to the committee a couple of months ago there were threefold really. One was to continue virtual meetings on hot topics, and I'll come back to what they were. The second was to support the regional networks and the SIGs that already exist in their connections, and to facilitate cross-fertilization between them. And I think today is a good example of how that can happen, but it's also a good example of enthusiasm at the time. And as Liz and Alison have both said very clearly, and as one of the other speakers said, how do we maintain and move the good ideas generated after a specific seminar as opposed to just generic facilitation. The third track of activity is to link with Faculty of Public Health developments such as the mentoring scheme. Bob Fryatt did a presentation, I think, a few months ago on the new MOU on with WHO on mentoring public health trainees in other countries, and that's early days. And Liz has also talked recently about another agreement. I can't exactly remember it now, but there are various things going on to keep plugged into. So for the next few minutes, what I'd like to focus on is first thoughts on future topics for seminars, and then come back to any suggestions from you on other ways of facilitating networking. And Alison herself has got specific suggestions on linking up with ASFA and things like that. But on the easier thing, in a way, which is topics for future seminars, let me float a few ideas and see if any of them have traction in the audience today. What I did was I looked at the existing special interest groups that there are, because there are very many in the Faculty of Public Health, and looked across them and what they were doing and what might be of interest to people from outside the UK, not just people working in the UK. And for example, a few of the ones that struck me were about NCDs and global health, and whether we could have a good seminar working with Jay Bagaria and her colleagues. Another one is around artificial intelligence and the implications for public health. Another one that's come up today was public health perspectives on mental health. There's interesting work going on in the European region, whether that would be interest more globally. And then a sort of old chestnut, really, but maybe new framing of old chestnuts, primary healthcare and public health. And primary healthcare is coming up yet again in various guises, and whether that would be a topic of interest to other people. So those are just a few, but I would be very interested to get any reactions either on those specific topics or thoughts for other topics for us to plan over the next 18 months. We're planning on 2 to 3 seminars a year at the moment. That's one thing. And second, in the same space, why not, follow up on to ideas from the AMR seminar today as a sort of example of how we might follow up when there's interest and enthusiasm beyond just sharing slide sets. I think, I don't know what the normal practice is, Liz, you can tell me, but some sort of short note of the key points raised from today, and we could share with all the people who've been on the seminar, or else all the people who are on the mailing list. But that's a quick thought on both topics for future seminars and possible ways of beginning to follow up on when there's enthusiasm from a seminar and not lose that momentum. So Liz, shall I hand back to you for fielding comments from folk?
No, it's okay. You can continue and ask people to raise their hands and. Yeah.
Right. Okay. Well, I jump in if I miss people. Is anybody raising hands? I can't see any at the moment. I could. Alison made some good suggestions to me one-on-one this morning. Alison, did you want to say any more of what you were saying to me?
Yeah, so the two immediate things were that we have a session with the ASFA's simulation in public health education and training group immediately before our next Europe SIG meeting on the curriculum, which is looking at the WHO Europe public health curriculum, and also the faculty's curriculum review to see particularly what's from the curriculum point of view, what's missing, what needs to be changed. But I guess there's also a bit about what's really important that we need to keep. The simulation is really is one of these things that's very important, particularly for people going into difficult situations for the first time, and may be useful for colleagues globally to access resources in other countries. I also raised the fact that my co-chair, Judith Simon, who unfortunately can't be here this morning, is duly trained in public health and health economics, public health physician by background, and has done some fantastic work on the public health economics, particularly in relation to mental health. And we know that there are very few of those folk around to get that kind of CPD, but also that she and her team presented some really fantastic work in the workshop that we did jointly between ASFA and the Faculty of Public Health on the core curriculum at the European Public Health Conference last year. So it'd be great to have an opportunity to bring that to a wider audience. Thanks.
Thank you, Alison. Anybody else want to make any comments or suggestions?
Judith is actually on the line and she's got her hand
Yeah,
up.
I managed to make it. So thanks, Alison, for raising this. Then maybe just to follow up on that, I actually just wanted to mention, I don't know whether this is within the scope or not, but today Lancet Psychiatry just launched a new commission on climate change and mental health. You can find it, and I know because I'm in the steering group, and just going on the topic, I think this might be another option that would be of interest for the greater audience and the global topic to maybe invite, not now, obviously it's just the work starting, but we are hoping to have the work finished in a year, so maybe later to invite the main messages and have a seminar about this. Thanks.
I see several hands clapping for that, so
Sorry,
maybe that is.
that sounds like
I
a good
said
one. Yeah.
I see several hands clapping for Judith's suggestion, so maybe that is one to come in. And you also mentioned AI, and just to say that I was attending the education committee of the faculty the other day, and there was a CPD session at the end of the day on AI and public health, and I learned a lot. It was much extremely interesting, much more interesting and much more going on than I thought. And I think it's something that if people are not using already, it will be come into the forefront very, very quickly. It certainly has a lot of implications on those in the academic field for, the teaching of students positively and negatively. And maybe it is something that we should be looking at broadly across. And I see a few hands clapping as well. So maybe that resonates. Benita?
Thank you very much. I actually can't see the hands clapping for some reason on my screen, or hands raised for speaking either. I'm not sure what my limitations are. But what I'm reading in the chat, that I'm getting support for those two topics at least, which is at least a pragmatic way to proceed on topics. And I think we will put thought into the kind of summary for this session that we share with people in the overseas members as a result, with some suggestions, including the suggestions being made for follow-up. I think with that, Liz, I can see Judith saying happy to follow up with Phillida. That sounds great. When the work gets to a stage, I note that too. So this won't be the next topic, But maybe we can explore the AI option as something that's a very hot topic at the moment, frankly. I can reach out to the leaders of that group. So, Liz, I think with that, I will hand back to you.
Thank you very much indeed, Phillida. And we will now move on to the next session, which is CPD Learning Hubs. And Munya Abdelaziz is our FPH International CPD advisor. Munya has many years of experience on CPD and leading and coordinating work on continued professional development. And I think that it's something that can be approached with enthusiasm or can be approached with dread. Many of us often look and think, oh my gosh, I've got to fill in that form and I didn't fill it in and I didn't complete everything. But Mona is one of the people that approaches it with the utmost enthusiasm. And I think I've gained some of the enthusiasm that she has shown over the years. So Mona, over to you.
Yes, thank you very much indeed. And I'm really pleased to be talking to you today about enthusiastically about continuing professional development. And the reason why I'm so enthusiastic about it is, of course, because it is your personal leadership journey. It is all about you, and it's about how you choose to make the most of what you're learning today to help improve your outcomes today and tomorrow. So I'm hoping that my screen is being is visible. Let me just check that I can click onto the next slide. So let's see. Right. So yes, this is your personal leadership journey. And we have a number of colleagues on the call today. And so we won't be able to invite you individually to contribute your story or part of what you may be struggling with. But what I'm going to do today is I am going to call upon at least 5 volunteers for each of my questions. So please find that hand button because I need you to put your hand up for me. And if we do get more than 5 hands up, well, it's to my discretion to include more. So first come, first served. Right. Okay, so what is it that I want to talk to you today about? I want to talk to you about utilizing your personal development plans for your work-life balance and for your career goals. And so this is about a third of what I want to cover today. So if you are struggling with your personal development planning, I need you to volunteer for this segment. I'm then going on to talk about reflecting on your CPD and how reflective practice improves what you learn, and then move on to the third segment, which is about learning hubs, where I'm pitching this idea to you as all overseas members that we set up some regional CPD action learning sets. I'm calling them learning hubs because it's shorthand for the learning that we could gain from those action learning sets. So CPD and my presentation are based on the Kolb cycle, which is around experiencing, reflecting, thinking, and acting. So first, let's talk about experiencing. Your personal development plans. What is going well for you now in your work and life? Do you have an area of special interest? Where do you want to get to in the next 3 to 5 years? Now, personal development plans are best set at the start of a year. But if you don't have a personal development plan, the best time to set it is now. So I'd need you to reflect on what's going well, where you want to get to, your area of special interest, because that is, once you have a very clear plan, clear objectives, then it makes it easier for you to get there quickly. In a learning hub, when we are a smaller group, perhaps geographically based, we will be able to discuss in breakout rooms what's going well, what's stopping us, where do we feel most stuck. And then from those breakout rooms, we will be able to bring together the emerging themes that we want to feed back to the group. Now, because we're limited on time, I'm going to shortcut. I'm not going to have those breakout rooms, but I am going to ask you as colleagues and participants in today's session to put your hand up if you want to participate in this segment around personal development plans. So for example, you may be asking, what is a personal development plan? Is my personal development plan good enough? I set a plan at the start of the year, but it doesn't help me get to where I want to. So any questions that you may have about your personal development plans, the time for you is now. And I need at least 5 hands to go up, please. I can't see the hands going up for some reason, so I'm hoping that some colleagues would want to join. Right, any hands gone up? Oh, if no hands go up, then I'm just going to have to volunteer, colleagues, unfortunately. I'm going to have to start with Philida because Philida's mic is off. So Philida, around personal development plans, do you have a personal development plan? Is there something that you kind of like you feel stuck with? And I will move from Philida to El Hadi next as well.
Okay, well, I'm going to have to be completely upfront. I'm very behind on my personal development plan. I've done them in previous years, so I could talk to that, where I would focus on areas of special interest, and that would be mainly to do with health system reform. Frankly, it would be content specific. How do I keep up to date on the topic of health sector reform in developing countries and health system development, particularly in the context of sort of universal health coverage and primary care. But I can't talk more about my personal development plan at the moment.
No worries. Thanks, Philida. I was going to nominate El Hadi, but I'll have Christian first. Christian, you're on mute.
Yeah, hang on. Can you see me now? For some reason, I can't. Well, maybe that's why it is. That's what it is. Yeah. Okay, now I can see myself. Yeah. Yeah. All right. So my situation is that I'm retiring in. No, not for you. Sorry. I'm retiring in November, and but want to. And that's retiring from my job in Geneva, because they make you retire at 65. And then I will be going back to the UK and still looking for occasional work in public health. So I haven't actually thought about personal development plans beyond my retirement, but I have my next appraisal in December. So it might be useful to start thinking about that. And it'll obviously be different from what I was doing before, because that was all very job specific.
Absolutely. So with uncertainty about not knowing what's coming next, there's huge opportunity because you can plan and you can make it work for you.
Yep.
So that's a really good question. That's a really good point. I'll come to Mohammed as well. Mohammed Abdullah. And you are on mute.
Hello, can you hear me?
Yes, we can hear you now.
Can you hear me? Yes. Assalamu alaikum. Hi, how are you? Dr. Romana. My name is Mohammed Abdullah. I do have a relationship with the public health field in many circumstances. And I do feel the need for having that personal development plan. And the reason why I said that is the fact that maybe I'll share similar feelings like what Tricia said, is that I don't have a plan myself, and I have been working there for such a long time. Now, unfortunately, I don't know how to sort this out. I'm just going to share that with you guys. It's the fact that every time I make a plan, it just does not materialize, you know. And I do work hard into those plans. Unfortunately, I get carried away with a lot of work commitments, and sometimes family commitments. It's mainly work commitments, right? So and then you can't say no. You're gonna have to do that, and sometimes that takes you away from the plan itself, because at some point you want to have some experience with certain topic, for example, and then your boss said, no, you're not gonna do that. So, for example, this is just an example. However, I think as well that this should not really be strictly to the professionals. So it should start a little bit earlier. I must say at university times. This is the thing that I'm just sharing with what I felt. Right, I have studied medicine and college medicine for University of Brooklyn. Safa and myself and Iman were the same batch, right? And they probably have had good plans. But I myself, I did not really have really. Why is that? Because nobody have told us. You know? There was not enough awareness. There's not enough, guidance. That's the right word to say. And also another notice that I have really noticed back then. I really support. I really, salute Alison. You see, the one who's making this international networking thing, and I think it's amazing. It's really important. And for one reason that I felt in my heart is back in the day when we were studying medicine, they were telling us we were studying Sudan, right? So they're telling us go and read from Oxford Handbook, which is fine. You know, it's great. It's a great book. I love that book. It was always in my hand. But when we're faced with the disease or sickness itself in Sudan, it has nothing to do with a 33-year-old Caucasian who lives in the UK. Right? Now, this sometimes interferes with the management, right? So we all know that environment, and other factors, are main factors: environment, genetics, and the horse itself, right? So this needs to be contained. Right? Anyhow, so this is why I thought I will just bring your attention to that. Thanks very much for this great meeting. I love that. Yeah, thank you very much. Very inspiring.
Thank you so much. We've had rich feedback from Philida, from Christian, and from Mohammed now. So what I'll do now is then actually move you into this point about how do we make your personal development plan work for you. One is have a plan, but two, make sure that your plan is comprehensive, because if it isn't comprehensive, then you find yourself distracted from your plan because something else that you hadn't planned for is coming in the way, like work-life balance. So what I always say in your personal development plan is have your goals for here and now. And Christian, that's right, goals for your current role, but also goals for your future career. And the reason why you have to have these two together is because your future career is always in the future. You're always going to be here and now. So as you plan for the future, you can put a couple of or a few scenarios for what the ideal future for you looks like, and you put that in your personal development plan as well. Goals for here and now, those include your goals for your current job role and your voluntary roles. So for example, on special interest groups, faculty membership, what is it that you need to learn here and now? And I think, we always have meetings about meetings. Why don't we have plans about plans? So make sure that you are regimented in reviewing your personal development plan at certain milestones during the year. So it doesn't become stale. It isn't set, for example, in January and then come December or the following January, oh, what was in my plan? So your goals for here and now are for your current job role, your goals for your area of special interest, and Philida, you shared that it was health system research. So what is it that you are doing around your health system research interest? How are you developing that? Now, people, in public health, we've got lots of diverse backgrounds. So our area of special interest will almost be as unique as we are. But we have to become known for that area of special interest. It has to be something that we are getting better at. It's something we love, but it's also part of us making sure that we're getting the outcomes at the end, the better improving health outcomes. Even if we're not getting paid for it, we're doing this work as a voluntary enterprise. And then finally, goals for your work-life balance, because life gets in the way. So if you are managing time, your work in work time, and you're managing life in lifetime, you'd be able to manage both and to juggle both. So for example, and I'm going to use my own example, Christian, to answer your question about retirement. I retired in April, and here I am working almost half of the week on enterprise, some of which are voluntary, some of which are freelance. I think the reason why that's happened is because I communicated early to colleagues that once I retired, this is what I want to do. So the personal development plan, if you set it now before December, before your appraisal for retiring, it means that you are having those, making those connections already, using your networks, making sure that, your friends and colleagues and your family know what your intentions are, and that you have a plan for, okay, then I noticed there's a question in the chat about might you be relocating. So making sure that colleagues in the country that you're relocating to are aware of that. Okay, so this is your personal development plan. Once you've covered these 4 areas, it's comprehensive enough to carry you through the year. And sometimes I would look at my work-life balance and try and audit it. So I have a timesheet and I would look at my time management and see how much of my time is spent on my voluntary activities, how much of my time is spent in work, which means there's very little left for family and very little left for me. So I just retired early because so that I kind of like wanted to be able to juggle and do the things that mattered to me. So these are all just examples, but use this template. This is the faculty template, but as you can see, I've pre-populated it with these 4 aspects because these are the most useful 4 aspects for you to put within your plan. Now you'll notice I'm only on slide 7 of 20, so I must scoot. Let's move on to, experiencing. So we've experienced blockages in terms of our personal development plan. We experienced life getting in the way. We've experienced an incomplete plan that never reaches fruition. Okay, let's reflect on that. So the reflecting part of the Kolb cycle is your CPD. So again, in a learning hub, what we would do is we would go out into breakout rooms and we would talk individually about, some of the themes that resonated with us in this group. And I think, from what I've heard, I think it's about time management. Let's just talk about a little bit more about time management, about how do we juggle all of these different issues that we know are important to us, we've committed to, we've said yes to. So part of time management is also being able to say no, for example. So the question that I want this learning hub to focus on next is, okay, then, how do you manage your time? And I'm going to need some other colleagues, who hadn't volunteered before for the PDP segment to actually volunteer now for this reflective thinking around quality improvement and how you use CPD every day, every month, every year to meet your personal development goals. Now I'm waiting for a couple more hands to come up again because it's not fair to go back to the same people. So I need a couple more hands to come up now around your CPD, even if you don't know what you're doing, kind of like that's the whole point. This is the learning hub where you get to find out more about how your CPD could be more effective for you. I don't want to pick, but kind of like I think maybe some. Oh, Victor, thank you so much, Victor. And please, could someone else, at least 2 others, raise their hands? So, Victor, I'm coming to you. What is it about your CPD? How are you using your CPD?
Yeah, so I echo the points you mentioned. I use my CPD broadly. I do achieve, but there may be 1 or 2 that I carry on, partly because factors within my control. But perhaps one of the key things is thinking about it every week or every month. Probably it may not happen that way, but it's still at the back of my mind. I need to do these 3 things. Key thing is not to have too many, because you get confused. Probably, I think, as they said, 3, 4, 5 maximum. So you can be able to take to achieve them. I think the biggest one is the one you highlighted, work-life balance. Because, for example, I find at the end of the year, I still have annual leave, and towards the end, I have got a lot of things in diary, so I can't take those annual leave. So those are some of the things you learn by experience. That how do you overcome this kind of situation? So that's kind of reflection.
Thank you, Victor. I think that's a really important point. If you can't even take your annual leave, let's go to Nadika then.
Hello, so I'm from Sri Lanka. Hope you can hear me, right?
Yes, very good, thank you.
Yeah. So what happens here is like until we are a trainee, during the training period, postgraduate training period, people are very keen about the CPD and whether you gain all the credentials. But once you become a consultant, the foci of enthusiasm is always inside. So you have to be self-motivated. So being an academic at University of Colombo, what I do is I have very few, as some of the members said, I have very few goals. For example, now what happens is my main priority always becomes teaching. And then the research and the service delivery gets down. So what I decide is every year I will be publishing 5 articles with at least 2 being the first author. So by July, if I haven't kind of submitted at least 3, then I know, okay, now I'm not going according to my schedule. So that's my long-term kind of the annual goal. And then every week, Sunday morning, I usually write down all the things that I should be doing, which carries forward from the last week. So if my research work is getting carried forward because of my teaching and the service delivery activities, then I know, okay, now I need to focus, and then I dedicate a day where I stay at home or kind of prioritize my research activities so that I will do all 3 equally. So that's what I wanted to share. Thank you.
Thank you, thank you. And it seems like research is your area of special interest. I'm glad that you've put that in there, and you're also using the planning every week, actually, not even just every month or every year. So that's really good practice. I'm just wondering, so Mohammed, we'll give you just a couple of seconds and then we'll come to Ishraka, because Mohammed, you did have a chance before. So Mohammed, just have one comment and then we'll go to Ishraka and I'll move on. So Mohammed.
Yes, thank you, Dr. Amana. Thank you for that. The comment is just around the CPD should be something that is aligned with possibly the strategy of or the direction of the healthcare organization, maybe the national healthcare plan, and in that way, even regional, or even the world, right? So it gives you maybe the feeling of that you are doing something, not just for yourself, but you're doing something also for the community. And I think that would be encouraging as well. So I encourage people really to sort of find a way to link or align that CBDs with maybe a local strategy or the institution strategy or the national strategy. But also, Dr. Ramana, I think it's very important to raise that awareness from the school, from the medical school. People really need to know that. They need to know what CBD are, and they need to know why is it important, can I just give you one more example? The fact that, is it okay? One example? Or
sorry, Mohammed, Ishraka is waiting. Sorry, Ishraka is waiting, Mohammed.
Yeah,
so
yeah,
drop
sure,
it in the chat.
No worries,
Please drop it in the chat. So
yeah,
Ishraka?
Okay, no problem. Thanks.
Ishraka?
Thank you very much, Dr. Aziz. I just wanted to reflect on something that you mentioned earlier about moving to work in another country, because I have moved from the UK to work in Canada in the last 2 years. And as such, personal development, first of all, being a UK trained GP and public health specialist has really embedded CPD into my psyche. It's just like I learn something new every day. I am very conscious about my learning needs. I know that is different from putting a CPD in terms of 1, 2, 3, 4, 5 goals. But when you move to a different country, it's almost sometimes it's an hour by hour learning journey. So I think what I do is about reflection. So I reflect daily on what I have learned. And then, if I want to develop, write a personal development plan at the end of the year, rather than at the forefront, I will find that I have achieved so much. And this is just because I was moving from one health system to a completely different health system, where I needed to really be on my feet as soon as possible. And, it's a huge learning curve. So I don't know if that answers the question, but it's just to say that CPD is a way of life for me, rather than, just something that you do annually and, with 3 or 4 goals. Thank you.
Thank you so much. So those are really valuable comments, and particularly because it's cyclical. So when we go into the actual COPE cycle, you see that the end of one year is the start of another. So that's kind of like how it will operate for all of us. So what we've just had here is a little bit of a learning hub practice, where one person presents a question, like I did on time management. Everyone is listening without interruption. And then we went around, we gave time for each other. The bit that was missing was the breakout rooms, just to make sure everybody has a voice. But the point is that to avoid interruption, but you have to keep yourself succinct to 1 minute each. Despite having a whole lot of contribution to make, it's being able to distill that and to be able to, convey your main messages as quickly as possible. So in a learning hub, when we do set up these action learning sets on a geographical basis, this is what we're looking for. We're looking for contributions from everyone where we listen and we contribute. So reflecting on what we have learned so far from today's session or even from today's CPD, I think this is what you need to write out. This is the faculty CPD reflective note. Yes, we reflect daily. Yes, we reflect weekly, but actually we need to reflect on our personal development plan objectives at least once a year and write them up in a reflective note. So this is what you are meant to be putting into those individual reflective notes. Yes, the faculty says you only need to have a maximum of 6 reflective notes, between 3 and 6 for each year. Use the faculty diary for all of your reflections, all of your important reflections, and then select the ones that you feel are important enough for you to submit for audit, should you be requested for that audit that year. So about 1 in 5 members are selected for audit each year. So you may be requested to submit for audit your 6, the ones that you select in particular, just once every 5 years potentially. Now, why are we doing CPD? We're not doing it for the faculty. We're not doing it for the audit. We're doing it for ourselves. It is our personal documentation of our personal leadership journey. So I'll take you back then to, we've experienced life, we've experienced work, we are planning for our future. We're reflecting, so we are reflecting on what went well, what hasn't gone so well. The best thing to do is to think with other people, because if you look at experiencing and reflecting, they're very individual, siloed. You've only got your perspective. So the action learning sets mean that you bring people together and you think together. So it's that thinking time that we want to set up in the CPD buddy scheme. Learning hubs are based on Nancy Klein's Time to Think. So I've put in there just a link to her ebook for you to be able to create a thinking environment. You can create a thinking environment at work. You can create a thinking environment at home. What we want through these learning hubs is to practice using these inclusive techniques to learn together, to think together. And if we take these back into our workplaces, it will help us get the best of our teams and the best out of our partnerships. These are the 10 components of a thinking environment and a draft agenda for a learning hub. So my recap to you is can you take this, what we've learned today about your personal development plan, about your CPD and what's stopping you, take it into regional action learning sets where you're thinking together with colleagues, and these colleagues will become your CPD buddies. I think that's something that we're missing at the moment. CPD is very individual, but if we convert it into a group activity, into an action learning set, then that would be would help us get the most out of our CPD. And then over to you. It's time to act, because you know what? You've experienced, you're reflecting, you're thinking in a group. Now is the time for you to act. We need you, actually, you need to set up your regional CPD buddy scheme. That's where I pause and I'll hand over back to Liz. Thank you.
Thank you very much indeed, Mona. I think that is, I see lots of claps, lots of comments in the chat that this has really resonated with everyone. I think in terms of next steps, one of the issues is how to set up your a small hub with others from your region or your areas, with other colleagues. And I think that, I mean, Alison is commenting that it's one of the key roles of the Europe SIG, that her and Judith want to move forward. I mean, maybe Victor as part of the Africa SIG, I think it would be extremely useful to look and see how you can move forward in the African region. And any help that is needed. I think Mune is available for any help that is needed across the the SIGs. There is quite a few people from I think the Gulf region and beyond, and there is a Gulf SIG, so maybe this is one of the areas that that they also can take forward. I love the comments from our colleague from Sri Lanka, and I'm sure that from that area, Southeast Asia, there would be a potential for people linking together, and at least sort of starting with a small group and then seeing how you can move it to small learning hubs together. I don't know if there are any last comments that people want to make. We've got a few minutes left, but I also note that a number of people are already leaving. So any other comments, or we will close the session? Victor, did you want to make a comment? You're on mute, Victor.
Yeah, thank you. Sorry, it's a brilliant session. Thank you, Mona, for this. I think we can take this offer in terms of how we can be able to socialize it within our special interest group, Africa SIG, and we'll call upon you. And I think even previous session has been wonderful. So we'll continue to learn a lot. And I think this kind of exemplify the importance of this webinar, where we can take new information and help enrich not only ourselves, but people who may not be at such meeting. Thank you.
So thank you all very much indeed. We will make a summary of the key outcomes of the session. We will be able to share the slides on that link as well, and we look forward to seeing you at future sessions for the overseas members. Have a good day, and thank you all very much.